Sawadika, this is your host, Kusuma Yotha Samut. Welcome to Thailand today. Although the science, medicine, and technology today will be developed further, advances dramatically, but HIV infection you could not be eradicated. In fact, patients with these diseases could survive in the society as normal people. Just be acceptable, especially someone very close to you, especially someone close like family members, which is the most important things that will help the patients live happily. Thai Red Cross AIDS Research Center has been established to help patients with these diseases to live longer anyway. Thailand today has a Professor Dr. Prapan Panupak. He is the director of the Thai Red Cross AIDS Research Center, who is well qualified to tell us about AIDS. Please welcome Dr. Prapan Panupak, the director of the Thai Red Cross AIDS Research Center. Sawadika.
Sawadika.
Welcome to Thailand today,
Yeah.
Doctor.
Thank you for inviting me to come to this television talk. Yeah.
We need you actually. We need you to tell
I will try
the
to
rest
do.
of the world. So first of all, doctor or professor, what is this AIDS situation in Thailand?
The situation now in Thailand is much better than it was 10 or 15 years ago. We have much less number of people who are newly infected. Instead of having about 100,000 being infected a year, right now it's estimated to have only about less than 10,000 newly infected a year, which is quite a high number, but it's much better than in the past.
So what the past actually?
Yeah, the past was, there were about 100,000, 150,000 newly infected persons a year, and also almost another 100,000 deaths a year. So right now the death rate is also lower than about 5,000 or 6,000 a year, which is much better.
Much
Yes,
more.
it is.
It seems to be like a good news for us. I mean, we have a better medication or what?
Yeah. I think this is actually the trend throughout the world that people with HIV now can have access to treatment, very effective treatment. Once they are treated, they will have a normal lifespan. They will live as long as the others. And also, once they are treated, they will not transmit HIV to the others. So the newly infected persons has been decreasing throughout the world.
But the knowledge of transmitting, being known to them, when they should not have the intercourse, they should not do this, that. Is there a message to reach them enough, sir?
Yeah, good question. The message of preventing HIV, I think everyone in Thailand, in the world, I think they all know. They should use condom when they have sex with other people. They should use clean needles when they inject drugs, for example. However, drug use and sex is something that people love to or enjoy to have it. And sometimes when they do this, they don't have the immediate tools, i.e. condoms or clean needle at hand. So, they just risk that because they love to have that kind of act, and then they get infected. So I think the knowledge is there, but whether or not they will do it, for example, using condom every time that they have sex with other people, that may not be the case. That's why the newly infected persons have come up.
When compared to our country and ASEAN, what rank are we? We are not ranking, but see the percentage, is there any calculation for that?
Yeah, that's also a very interesting question. I think Thailand is probably one of the very top country that we can curb the HIV epidemic very well. I can say, I would also have to say Myanmar and Cambodia are also along the same line, whereas the other Asian countries like Indonesia, it has been known that the new case of HIV in Indonesia is increasing, rather than decreasing like Thailand or Myanmar or Cambodia. However, I think Thailand has been considered by the world, by WHO, by UNAIDS, probably maybe the first country in Asia, not in Asian, in Asia, or maybe the first country in the world that we can end AIDS by the year of 2020, the longest maybe 2030, because the reason that throughout the world they are expecting Thailand to be the leader or to be the first country that can end AIDS by another 5 years from now, another 15 years from now, because we have the policies in place. We have the policy that people in Thailand, everyone can have HIV testing twice a year. If you find HIV positive, you can be treated immediately rather than to wait until your CD4, the immune system, drops to a certain level, which is the perfect setting and also the infrastructure of the Thai medical community that can test people and treat people. So by this way, because once you know that you are HIV infected and you are treated, by 6 months, that person will not transmit HIV to the other people, and that person will have a normal life as non-infected persons. That's why ending AIDS means having the number of newly infected and also the number who die from HIV/AIDS come below 10% of the level at the present time. So, for example, we have 10,000 new infected a year. How can we come? No, we should come down to 1,000 new infection a year. That means ending AIDS.
Is it possible?
Yes, we know that how to do it. We know how to do it. Okay,
great.
So now we need certain commitment. Now, not much of the political commitment because the policy is there. But how can people, you and I, okay, can join this effort? I.e., for example, how should we convince people to go up for HIV testing? I think this is right now the most important thing is HIV testing.
I heard, but as per in the newspaper, that we ourselves, Thailand, can produce our own injection or some kind of medication.
Yeah, I think you're talking about the AIDS medications.
Yes.
Yeah, the so-called government pharmaceutical organizations, or GPO, which is the government real estate. Yeah, we can produce many, not all. Now, many very good, effective AIDS drugs. No, not because we are very keen in discovery the new compounds. No. These are the compounds that are being developed by other countries. We just buy the new the raw materials from either India or China or Brazil, and then produce it in our own factory here, and so that the price will be very, very low.
So how do we have the measure to protect all this, for them to change their mind for this kind of thing?
Yeah, this is also a very important question, difficult to answer. As we discussed earlier, that having knowledge how to prevent it, or even having condoms at hand, okay, whether or not this can prevent HIV infections among men having sex with men, the answer is no. No, they're still being infected because as I think, not because they are bad people, not because they don't know, okay, but just because of their lifestyles, okay, having many partners, enjoys the swinging around, using some recreational drugs while they have sex, so the use of condom then will be low, so they are infected. So the strategy that Ministry of Health is doing nowadays for this group is, we have to get the message to them that they are very close, or they are very likely to be HIV infected. They should have the blood test, okay, at least once or twice a year. And once they are tested positive, they should be treated right away. Okay, that's why the so-called test and treat campaign for this group of people, that which is very, very well-known approach worldwide. Okay, and for example, this coming Tuesday, the Minister of Health in Zimbabwe and his team will come to the Thai Red Cross AIDS Research Center to learn about how Thailand is doing test and treat, so that they can learn something to do in their own country.
This is real has raising for me, because that the country, it seems that HIV is happening more from
in
spread
African
from
countries.
Africa's countries. So they come to learn from us?
Yeah, because we have, what we are doing or what we have been doing in the last 3 or 4 years, something very interesting that other people should learn from us, even the US.
Oh.
Yes, because for example, how to reach those men having sex with men on the street, okay? How to reach them, how to get them committed for HIV testing and for the treatment. This is something that is not so-called not generic that you can find. You can do it everywhere. You have the cookbook to do it. There's no. You have to learn it by what you are doing.
Doctor, I wonder whether this HIV can be cured, and AIDS already done, finished. I mean, you have to get treatment only. Is that so?
HIV
can be cured. I mean, this kind of can be.
HIV can be treated.
Once
HIV
can be
infection HIV infection can be treated successfully, so that the people who are treated will have a normal lifespan.
Yes, totally.
Whether or not it can be cured, that's another story. Another story. From what we know, once you are infected, you will never be cured because the virus is so keen that it will just hide inside your body. Okay, but you may hear some news, also some good news that's also taking place in Thailand at the Red Cross. Is if you are tested, if you're detected, you are infected early. I mean 1 week or 2 weeks after the viral entry into the body. Once you are detected that early and treated that early, namely treated within 2 weeks after infection, there's a possibility of the person to be cured. Namely, they may not need to take the medication throughout their life or for the whole life. Maybe just only 4 or 5 years and they can stop it. So this is what we here in Thailand are doing, and at the Red Cross, and it's also something that worldwide, throughout the world, they are watching us about the results. Okay, right now we are at the stage of stopping medication of some of these people just last month. We don't have the results yet, but this is something that everyone is watching.
Stop means that this particular person has been using for how many years?
Yeah, 3 to 4 years.
3 to 4 years, and now you're doing the
medications. Yes,
that's a volunteer. They are volunteer to do that. To get into the course, like.
Yeah, because these are people who are enrolled in a study that we do at the Thai Red Cross Research Center together with the U.S. Army. Okay, U.S. Army, where we can detect people who are just newly infected. Newly means only 2 weeks after the viral entry, which is a very important thing here. Okay, because many of these people just go to see the doctor because they have some fever, headache, and some rash.
No, let me interrupt you this. But once you get into your body, like 2 weeks, like you said, you get some feeling, you get headache, you get the fevers. I mean, the disease started.
Yeah. No, not normally. A big percentage of these people, when the virus gets into the body, within the first 2 weeks, for example, or even 1 week, they will have fever, like flu-like symptoms, like MERS-like symptoms, or whatever. And many of these people, they went to see the doctors in the hospital, and doctors just treat them with flu, for example, with flu or common cold. But they realize that they are at risk for HIV. So that's why they went or they come to the Thai Red Cross Anonymous Clinic to get HIV tested. Okay, and the test of HIV at the Red Cross will automatically, with the negative specimen, the test negative during the daytime, with the more sensitive test that at the clinic, they will be retested at night using the so-called NAT technology, nucleic acid technology, namely to detect the gene of the virus rather than the antibody of the virus. That's why we can detect people earlier, much earlier, like a week or 2 after the infections, after the viral entry. So we just call them back and then start to get the treatment. So we have almost 200 people now on this study, newly infected and early treated. And we will see out of these 200 people or so, how many or what percentage of them we can stop the medications forever.
Yeah. One thing it is just for the people who do not really know about it. I would like to have a doctor to say it about the children of a couple. Supposing they have between them. And how about the children being at home or what? How do they get affected? Or maybe from when they're pregnancy or something?
Yeah, this is called mother-to-child transmission of HIV, or
yes.
MTCT, mother-to-child transmission of HIV.
Yes.
Then we heard about the word PMTCT, preventing mother-to-child transmission.
Yes.
Okay,
How do
this has been known since 1994.
Yes.
Okay, that means if you give treatment AIDS medications to infected mothers, infected moms, as well as to give the AIDS drugs to the newly born infants for another 4 weeks or 6 weeks, you can reduce or cut down the rate of transmission to the child down from 25 to 30% down to only 1% or less than 1%.
Wow, this is good.
Yes, this is what Thailand is also doing. Using three drugs for treating infected mothers. This is, I think, for Thailand. This was started only in 2012. 2012, just
like
3 years ago. 3 years ago, using 3 drugs to prevent mother to child. But what I'm saying here at the Red Cross, we have these 3 drugs for infected mothers since 2004. 3 drugs. You may have heard about this the Princess Somsawari Mother to Child Donation Project, okay,
exactly.
the fund project, okay, which supported by Princess Somsawari. We started providing free AIDS drugs to infected moms throughout Thailand since 1996.
It's still going
1996 and still going on, okay, and from now 2004. We changed the regimen, the drug regimen, from 1 drug, 2 drugs to 3 drugs, which is the world standard medications since 2004. Whereas in Thailand, okay, they just started, which is good. So that more people in Thailand can benefit from this best prevention, from 2012, as I said. So the situation of infected newborns in Thailand is getting much better. So we hope, the whole country hope that ending AIDS in the newborn is probably the first thing that will happen.
Yes,
we hope.
Because it's so sympathizing with such children because they are nobody. They know nothing about what's going on.
Yes.
And they have to get
Same thing for the housewife. Okay,
yes,
we have to sympathy the housewife. They are just really faithful to their husband, but they're infected with the husband. So we should say HIV infected person is not a bad guy or bad girl anymore. Don't think that anyone infected is a bad person. Because this is also a stigma imposed on HIV infected person that they are bad. They must be gay. They must be drug users. But it can be anyone.
Sad. Well, anyway, we have a good hand. Listening to you, I feel so relieved for the people affected or whoever in a risky position. So, what is the center of the AIDS of the Red Cross work on this center? What is your main work?
Thai Red Cross is a center. It's a very small unit of the Thai Red Cross Society, which is very big. One of the main activities since the beginning, almost 25 years ago, was the so-called anonymous clinic or no-name clinic, where people can come in voluntarily without even telling their identity or their names. They can have HIV testing and counseling and testing. Nowadays, people walk in, they can even show their identification card now because it can be free testing rather than have to pay by their own pocket. So now the people are not afraid of coming up and showing their ID card because they know that the ID numbers will be immediately transformed to another code. So no one knows who has HIV testing or what the HIV test results are. So right now we are doing this kind of HIV testing together with certain interesting activities. For example, we have a clinic specifically for men having sex with men. So that people many things, okay, can come in and talk to people who know how to talk to these people. They can have, let's say, anal cancer screening. Anal cancer screening.
Yes.
We heard about cervical cancer screening. They can have anal cancer screening because they have anal sex. Okay. So anal cancer screening is very popular among gay. Okay. Once they come to want to get anal cancer screening, we also talk to them about HIV testing.
Okay.
So that
Yeah.
so because they may not even think about HIV testing, so they come for anal cancer screening. We also talk about HIV screening, and they also accept the HIV. So this is a way to attract people to come for HIV testing, especially for those risk groups here.
Yeah.
This is the anonymous clinic. So at the Red Cross itself, we also have certain activities like a test and treat in the community.
Yes.
We talk a little bit about test and treat. This is a test and treat in the community. It's also a very big project that we do at the Thai Red Cross Agency Center. We heard about the organization called HIPNET. HIPNET is HIV, Netherlands, Australia, Thailand.
The joint hand.
The joint hand to hand to do some clinical research. To treat HIV people.
Okay.
We heard about this newly infected patient study, the study of the so-called acute infection within the first 2 weeks of infection. This is also another research project that we are doing here at the Red Cross under the name of the unit called SEARCH, the Southeast Asian Research Collaboration with Hawaii, with the U.S. Army. So there are many activities that the Red Cross.
They seem to be in good hands. So please talk about the day. You will have a day to what you call the HIV testing day. So how you call it actually?
Yeah. The short name is VCT Day. VCT Day. VCT Day. VCT stands for Voluntary Counseling Testing Day. That means the day that we campaign for voluntary HIV testing. We set it up. We mean Thailand set it up on the July the 1st, so-called VCT Day. After we set up this VCT Day, I went to the US, and they also have they have VCT month, the whole July of that month. So this is kind of a campaign that people should think about HIV testing, because we think that HIV testing is the most important thing and the entry point for HIV prevention and care nowadays.
So we all know that we at least we have a community, or we have an organization who really have a real good-hearted, feeling good, trying to solve this problem for them. So they should be cooperate quite so much about this matter. So this is going to, unfortunately we have short time, we need to talk more about that. But so lastly, I would like you to just talk again to them that how to lead their life safely from the HIV.
Prevention is very important. There are many things for prevention beyond knowledge, attitude, behaviors, condoms. We also have so-called using AIDS drugs to prevent infection. Nowadays, a new thing here is called PrEP, P-R-E-P, pre-exposure prophylaxis, which you can get it from the clinic, the hospital that you go to. But I think the most important thing that I would like to tell our audience here is everyone should know their own HIV status. Everyone should know their own HIV status by going to have HIV tests at least once in their lifetime together with their partners. If they're negative, they can lead a normal life without even using condoms. But for those who still have the continuous risk behaviors, they should have frequent HIV testing. HIV testing nowadays in Thailand is free of charge. It's twice a year that you can do that. So please do that so that you can start your life in a better and more steady way, that you can prevent yourself from infected throughout their life, and also you can prevent others from being infected. You can have a normal life, even unfortunately you are infected, because treatment is free and it's also available and so effective.
That you have a channel of trying to lead your life in proper way by the advice of doctor. Thank you for watching Thailand Today, and I am Kusuma Yotha. Hope to see you tomorrow. สวัสดีค่ะ Sawasdee ka.